we talk about mercury fillings, a lot of people have talked about getting them removed. That can be a risky procedure. Is that correct? And you have to know what you're doing and who you're going to.
Yes, and from my perspective, because I'm kind of like the people's guy, I'm the patient's perspective versus the dentist's perspective, because you probably talk to a lot of professional dentists. A lot of people have 1 or 2 mercury fillings. They feel fine, and they get it removed, and now that tooth doesn't stop bothering them, and they're very upset. So why does that happen? One thing is, in order to remove the mercury, the dentist has to drill. And if they don't drill very carefully, they're going to hit and drill these very deep spots in your tooth. So that can cause pain. If they don't seal, if the glue they use is for the composite filling, if it's too, if it dries too quickly, it creates like a suction on the tooth nerve, and that nerve gets inflamed. The other more obvious problem is when they drill out the mercury, you have mercury powder and dust going everywhere. So you want a dentist to have a rubber dam. The IAOMT, International Academy of Oral Medicine and Toxicology, I think they have a pretty solid list of dentists who know these protocols. Also, Holistic Dental Association might be another place to search. And there's more issues. Just because the filling is not mercury doesn't mean the filling is safe. Most filling materials are plastic, and they react to people's immune systems, and they leach chemicals into people's bodies. So what I did, and what I tell people to do, is some good holistic dentists will give you testing vials of all the different filling materials that they've already researched and investigated, that these are the best materials, they know how to use them, they're relatively safe, and then you see how your body reacts, because this body is an intelligent system that's well beyond the human mind to understand, and this intelligent system gives us answers if we ask it. So you can use the cranial sacral rhythm, you can feel people's pulse in their system, how it reacts to fillings. Muscle testing or applied kinesiology is another way to test. Sometimes people have an intuition, they want a certain material. So when I got my mercury taken out, I found a dentist who said they're going to drill very slowly and didn't touch my teeth. And of course they have all the vacuums and rubber dams, and the dentist is like in like a spacesuit almost, because this is toxic stuff. And then she had materials also that were safe, that I had tested, and I got mine all done at once. There was no pain, no nothing. I felt good. There's even more you can do beforehand, which I haven't, let's say, investigated as much as I could, where you do different detoxing procedures before and right after to help flush the mercury out of the body, and also to help prepare the body for the drilling. I mean, just me personally, I ate a lot of butter and butter oil, so my teeth were really hard, and it was overall a good experience. And it took about 4 hours to do 7 fillings that were placed when I was a growing teenager. So when teenagers grow, they have a very high mineral demand, and if they aren't consuming enough or the right food or too much sugar, then they easily demineralize and they get little cavities. And instead of the dentist rescuing the teenager and saying, hey, you have cavities, you're not eating well, and this is going to affect how you grow, they just put some material in there, off you go. And your permanent tooth is destroyed now.